Good morning. Welcome, everyone, to the 30th anniversary of the International Academy of Biological Dentistry and Medicine. And it's the Pearl anniversary. Everyone should have got pearls in their bag. And a little pearl, mother of pearl guitar pick in commemoration for the 30th anniversary. I'd like to, first of all, thank Dawn and Toby, the glue of our organization. Without them, nothing would be possible. And give a thanks to Kim and Farah, who are filming for us today. So, a few logistics. All the vendors are in the little bubble over here, and so is the coffee and tea. So if you want any refreshments, you have to go over there and visit them anyway. We also have some lunch and learns during the lunchtime, and the list of the different speakers are on the back door there. It's been my honor to be your president for 2 years, and I'm going to be handing the reins over to Dr. Felix Liao. Let's give Felix a big round of applause.
It has been my pleasure to work with Joan, and Joan's not one to brag, but in her 2 years here, she's been very instrumental as far as really getting us more involved with the anti-fluoride campaign, and she started a mentorship program. She personally calls or emails people that say, yes, I'm interested in a mentor, and tries to figure out, what might be a good fit for them or what their needs might be. And it's really been my pleasure to work with you for the last 2 years. And because it's our Pearl anniversary, found this wonderful mother of pearl box and open it up. It's a beautiful strand of pearls. Thank you. Okay, Felix, it's yours.
Can we connect this thing?
To the other connector, though, there was something on the end here. Okay, while we're setting up, I'm going to ask Dory, the CE lady. Remember, this is what Dory looks like. Those of you that come up to me and say, I need something about my CE, it's not me, it's Dory.
Thank you. Okay, I'm going to be handing out CE packets, so if you want CE for the conference, just follow the directions inside the packet, but please be sure to put your name on the CE attendance verification forms. You'd be surprised how many I get, and I'm a little bit psychic, but not that psychic. So that's very important to completely fill out everything. And then at the end of the conference, just throw it all back in the envelope, and you're going to turn it into me. I'm in the vendor room over at Talk International. But it's just, like I said, very important. I'll be reading codes at the end of each session, and you'll be recording those. And then there's surveys in there, too, that really help Dawn a lot with feedback on the speakers. That's really important. Also, just this isn't CE related. As a benefit to the members, we're recording little vignettes. So if you can... I'll come back and pass out. We're going to pass around an appointment time, but what we'd like to do is record the members saying, why they went into biological dentistry and why they joined the IABDM. And this is something you can use for your own website too, because we'll give it to anyone. So if you want to, use it as a little promo on your own website, but we would also like to use it for IABDM and also made part of a promotional video for IABDM. So it'll be a nice addition on their website too. So if you could do a sign-up time, it's just like a short, when it gets edited down, it's just going to be like 2 minutes. But we'll guide you through and interview you while you do that. But if we're going to pass around a sign-up sheet, and if you would just sign up for a time, just a 15-minute slot sometime over today or tomorrow, that would be really great because they're going to look good. Okay.
Good morning. Thank you for being here. On behalf of IABDM and the board, I'd like to welcome you and the speakers to our 2015 meeting. It's a great honor to follow you, Joan, and all the other brilliant presidents before her, Blanche Gruby, Mike Margolis, Bill Glaros, John Trowbridge, and Nick Myers. And of course, our most capable, hardworking Executive Director, Dr. Don Ewing. The theme this weekend is biological basics, whole health, whole foods, and whole team. The goal is to amplify natural health by mouth, starting with the airway, sleep, nutrition, and then on to circulation, regulation, physiology, microbial DNA detection, and finally back to growing new eyes to see teeth grinding as a clue to investigate airway distress during sleep. So Byron Braid, who was, how many of you know Byron Braid? All right. When I first started in biological medicine as a dentist about 15 years ago, I sat next to Byron, and I still remember to this day, it's an intimate seminar group just like this, and he leaned over and said to me, stay sharp. Because Monday morning, you're going to have patients who's going to show up with these problems. And sure enough, those patients, as if it's telepathic, they know that you've heard these speakers who will present this weekend. And they will show up with those problems that these speakers will talk about, okay? So you are in a small group called IABDM, and others with our, this IABDM is poised to make a big difference in conjunction with our strategic partners. I just want to mention two of them before we get started with our programs. One of them is Academy of Integrative Health and Medicine, IAHM. Remember this, you're going to hear about it through our newsletters. Basically, IAHM is a integration of the Chiropractic Association and the Osteopathic Association. And then it became interested in including the likes of us, biological dentists in its ranks, as well as acupuncturists and naturopaths. So it's going to be a powerful political force because they advise all the presidential candidates on what health policy and what health reform should be. We have been invited to join its association leadership council. So we have a voice in formulating the health policy advice that these presidential candidates get. Another strategic partner is Western A. Price Foundation. The contribution of Western A. Price is enormous. He is, I believe, is one of the original biological dentists. And Western A. Price Foundation founder, Sally Fallon, is going to speak later this afternoon. And I encourage you to visit with Western A. Price. I will tell you from firsthand experience that Western A. Price Foundation members make the best possible patients. They value oral health. They value dental facial development. They know nutrition. They place a premium on their health. They're willing to pay for it. And having the more of those patients you have in your practice, the happier you'll be. All right. So I want to just quote one of our leaders, John Trowbridge, on one thing. He said, the principal part of everything is the beginning. He says, as biological dentists, hygienists, and their physician colleagues, we are in an exclusive and enviable position to perceive the principal part of human maladies. We are the vanguard, poised at the beginning of the struggle to achieve vibrant health and avoid or reverse devastating disease. Okay, in the beginning, there is just the mouth. When a baby is born, life begins with a cry to inflate the lungs and a suckle to nourish growth and ensure survival. In the beginning, there is just the mouth. Okay, so this weekend, what we're going to do is empower you to go from biological dentist to become biological mouth doctors. We're going to have Dr. Levy speak on circulation as it relates to root canals and heart health. And Sally Fallon will speak on nutrition. And then we'll have lectures on different topics that will make you more powerful biological mouth doctors. So without further ado, I would like to have Blanche Gruby come up. Blanche? Blanche Gruby is one of the powerful forces that move this academy forward. And she's also the ambassador for the next speaker, Dr. Singh. You're going to introduce Dr. Singh? All of us. Thank you.
Dr. Singh, I don't know what else to say about you, except you're probably one of the few and the leading people in the United States and the world that really know how to look at somebody's head and the rest of their body and see how it fits. See, unlike conventional dentists, we know the head and the mouth are attached to the rest of the body, right? So Dr. Singh has been doing what he calls the DNA appliance. I call it biomimetic orthodontics because it all fits together and it mimics what the person was originally supposed to have. You're going to learn a lot from him today, so pay attention because you're really lucky to have him here. Dr. David Singh.